2 minutes after 6, so we're gonna get started. Thank you everyone for joining us tonight for the PTO meeting. We are looking forward to a great time with you all tonight, sharing information, getting some answers to our questions, and we'll also be providing some updates about some upcoming activities at the end, towards the end of the meeting. But for right now, we wanted to open up the floor and allow the doctors from St. John's to provide us some information. They're going to be giving us some insight about the vaccinations. And, you know, in the world that we're in today, there is so much going on, so many decisions to be made. And the newest one is the vaccine. So they were gracious enough to join us and answer any questions that we have. So I'm not going to take up any more of their time. I'm not sure if you all had information to present to us, or if you wanted us to just go ahead and ask any questions. So you can let me know which one you prefer.
Great. So I think that maybe, so thank you very much for welcoming us. My name is Don Morrish. I am, by the quick introduction of myself, I'm the Chief Medical Officer at St. John's Episcopal Hospital. I'm a physician. I'm a trained obstetrician gynecologist. I've been practicing over 20 years. So I know what primary care is all about. Tonight, I am joined with a great colleague that offers us a tremendous amount of support to the institution, Dr. Karen Muir. She's our division chief of pharmacy with us. So I'm really happy that she's here tonight because she brings a tremendous amount of expertise to the vaccine, in which she had a vital role in rolling out to our institution. So thank you, Dr. Muir, for helping me answer most of the questions here tonight with our guests. So thank you very much.
Thank you. Thank you for having me.
So I guess just by means of introductions and everything else, what I just wanted to do is just start tonight with just a little bit of an overview maybe of what's going on with vaccines in our community itself. And Dr. Muir will add some information on, because she's the expert on vaccinations and so forth. So at this point in time, one quick disclaimer that I would like to just discuss with everybody is the information that we give tonight is as much as information that we know. With the CDC, New York State Department of Health, and other agencies constantly changing their guidelines, we're trying to speak to exactly what we know of today. It might change tomorrow. It is definitely a moving target these days, and we're trying to keep up to it. But if you had any specific questions, we answer them tonight. They might not be as valid as they will be tomorrow, but we'd be more than happy to discuss it at any given time and be a good partner with you and the community itself. So just, I guess, to start off with is just maybe what we'll do is just talk about the 2 vaccines that are available in New York State. Both vaccines were authorized and approved by the federal FDA at this point in time, and also by the New York State Independent Advisory Task Force. And there are 2 vaccines. One is a Pfizer vaccine that everybody hears about, and also the other one is the Moderna. Both vaccines require 2 vaccines on day 1, and then the Pfizer vaccine, we have to give it 3 weeks later, where the Moderna is just a little bit later than that. It's 4 weeks. I guess I will just turn it over for a few minutes to Dr. Muir to maybe talk a little bit about the vaccine itself, maybe a little bit about the vaccine program that we have up and running over the last month or so at St. John's, and then talk a little bit about how it might affect our community and how it might be accessible to the community in the future. So without further ado, I'm going to pass it over to Dr. Muir for a few minutes, and then we'll go back maybe into some questions about not only the vaccine itself, but also COVID testing, and how you as parents, as I am, since I have 2 young kids at home too, are concerned about different things and have questions. We'd be more than happy. Okay.
So as Dr. Morris alluded to earlier, there were 4 vaccines that were in the making prior to COVID-19.
Excuse me, Dr. Muir. Excuse me, Dr. Muir. Please, everyone, mute your tablet or your laptop for a moment so that we don't have so much background interference. Please mute. Thank you. Pardon me, Ms. Dr. Muir.
Okay, no problem. So prior to the COVID-19, during the COVID-19 pandemic, there were 4 vaccines. one by Pfizer, one by Moderna, one by AstraZeneca, and Johnson's & Johnson's. The two vaccines that are currently okay for use now that we did receive use from the FDA, as Dr. Morrish pointed out, is Moderna and Pfizer. Pfizer was the first one that obtained authorization use. The Pfizer vaccine is good for patients that are 16 years and older. It's 2 doses. First dose on day 1, and then 21 days after you could get that dose. That vaccine requires ultra storage, specific storage in an ultra cold refrigerator. It has to be stored at temperature minus 86 degrees. Once you take that vaccine outside of that freezer, then it has to be thawed out for like 30 minutes at room temperature. And then you could, after you prepare it, it's good for 6 hours. The Moderna vaccine is good for age 18 and older. It's 28 days after the first dose. And it does not require that ultra storage that's required. It can be kept into the refrigerator for 7 days. At St. John's Episcopal, we did receive the Pfizer vaccine. We're currently in the process of vaccinating our employees as per the guidelines that is set by the state on the phase 1 with this vaccine. And vaccinating is in different phases. So under phase 1, as set forth by the governor, we're now vaccinating all of our employees. And we're also vaccinating employees and employees' family that falls under phase 1B, which are family members that are greater than 65 years old. Maybe Dr. Morris could give some of the other guidelines. Greater than 65 years old. If it's a frontline grocery worker, there's about 12 criteria, and you have to fall into one of those.
Yeah, corrections employees, pre-K to 12 school workers, which is a really important group to you yourselves, employees of colleges, childcare workers, early intervention workers, public transit workers, and persons living or working within a homeless shelter. So it is quite a long list.
It is a long list. So we did receive quite a bit of the vaccine, and we're actively vaccinating all of our staff and community, because we're all trying to work together to make sure that we're protecting our employees as well as their family from getting this COVID vaccine, COVID disease. I'm sure that we've all known someone who's been touched by this disease. As you know already, St. John's Hospital was one of the first hospitals that has gotten a COVID patient. So we've all dealt with COVID, and it is a horrible disease, and getting the vaccination or being able to vaccinate each other is just the most wonderful thing. So currently there's 2 vaccines available right now, Moderna and Pfizer, but the one that we do have at the hospital is the Pfizer vaccine. Did somebody have a question? I heard something. Right, so that's what we have now. So we have what's called a pod. And so once the employees come in, they have to first sign up for the vaccine. They have to also register with the state. So that way, in the event that the employees experience any ADRs, they will be getting notification from the state. You come to the pod and you just get vaccinated. We give you a card initially once you get vaccinated, and that card gives you a date. You remember the old days when you went to get vaccinated and you got a card if you were born in the 60s or the 70s? So that's the same card that the state sent to us. And once we vaccinate you, we give you that card and you get your second vaccination, and we date that card again once you get it. And my guess is that that's the card that you keep with you at all times as proof of being vaccinated.
Great, Karen. Thanks so much. It's a good presentation to let you know what's going on in St. John's. For the community right now, we're not really sure particularly what we're going to be doing or if we'll play a role in vaccinating our community, for the mere fact that we take directives from the New York State Department of Health as well as the CDC. I know the New York City government is also trying to work in a program where we get local vaccination spots. We have not heard word or received any vaccines for the public at this point in time. Once we do hear word about whether or not we'll be vaccinating or there's going to be vaccination centers set up throughout the Rockaways, we'll definitely share that information with the rest of their community itself. So that's really important that you keep in touch with locally elected officials and other agencies to determine whether or not and when you might be available to take the vaccine itself. As far as that's concerned, that's as much information as we have on the vaccination that we want to share. If anybody wants to ask any questions or if they wanted to ask a little bit about COVID or COVID testing, I'd be more than happy. And I'm sure Karen also would be more than happy to answer any questions. So please feel free to ask away.
I have a question. So the hospital is still operating in pod 1A because I'm speaking on behalf of my staff right now. We're all in pod 1B because we work in a public school. But I'm understanding you to say that we cannot make an appointment yet with our local hospital to get that immunization yet?
Yeah. Unfortunately, no, we can't. You know what it is at this point in time, they sent us a very limited supply for our employees and the frontline workers. And although other institutions have progressed past 1A to 1B, they were given larger allotments of vaccine and they're able to offer it to other areas. And we're not able to do so just as of yet. We have to follow very strict guidelines as to who we're administering. And each time we move to the next phase, 1A to 1B, we need to be given an allotment of vaccines because not only do when we give the vaccine, as Dr. Muir had said before, there's a very prescribed way in which we do it. There's a lot of paperwork, there's a lot of tracking, and we have to follow the letter of the law with the Department of Health in doing so. If we are allotted more vaccine and we're able to and we're directed to do so, we'll be more than happy to address community members because we understand that our teachers and our local caregivers and corrections officers and anybody front facing that met that long list of 12 individuals that do have a lot of contact, that we actually protect them too. You know, as always, we want to be good community partners and get out this information, but we're really itching to get the rest of the vaccines out and to receive them and to hopefully vaccinate the public. And if we don't do it, we would sure be the first to share this information exactly where you can receive these vaccines.
Right. And so our intent is as Dr. Morrish mentioned, as soon as we do receive more vaccine, we will be sending out word to the public that fall under category 1B so that we could further vaccinate the community.
Can you speak to side effects? Because I know that for the people that I've spoken with, that's a major concern. I've heard various things. And so can you clear it up?
So Karen, if you want me to speak to it clinically, I'll be more than happy to speak.
Let me just speak to it personally. I've gotten 2 doses of the vaccine already, and I had no side effect, except that my arm felt a little bit sore, and it does feel sore with any vaccination that you do get, right? Once you get poked anywhere, you might feel a little bit sore. I have had no side effects. And my daughter, who is younger than me and fell under 1A, she got vaccinated and she got Moderna and she has not complained of any side effects.
Right.
So,
Which
I have a
one did you
question.
take?
no, Dr. Morrish, can you just
Yeah, sure. Same thing. I took the Pfizer vaccine. I received the vaccine, and I usually feel some discomfort associated with like the flu injection. I didn't feel anything this time. I was lucky. My second dose, I just recently received my second dose, and once again, I didn't feel anything associated with it. I didn't even feel any pain in my arm or anything else. But you know what people start. There's a few things I want to clarify as a physician, and I always love to say this: is that don't let the internet or don't let the news sway you. You know, speak to your doctor. I love to talk to patients of it because not only have myself and 1,100 or 1,200 employees received the vaccine, people might feel a little bit of tenderness at the injection site. They might feel a little feverish. they might get a little muscle aches associated with it, and they might feel like they might have a slight cold. That usually lasts about 24 to 36 hours at most, and it usually goes away.
Right.
And that's the biggest results
Okay.
we have. We always want to be super cautious. And as being a physician and being very cognizant of the fact that people are very sensitive and have multiple medical conditions, when you get vaccinated, the way that we're super safe is that we go through a checklist of conditions to make sure that you didn't have any severe reaction to any other immunizations. And there might be the flu, or that might be any other vaccination you might receive throughout your life, and to make sure that you didn't have a tremendous reaction to that. And then the next thing is if you had lots of questions associated with the vaccine and specific problems with your health, we usually ask you to speak to your doctor about it before you get it. And most doctors will talk about the risk, the benefit, and if there's an alternative. Unfortunately, there's no alternative other than the vaccine at this point in time. But even as an obstetrician, our American College of Obstetrics and Gynecology tell us pregnant patients, the benefit of it outweighs the risk of it. And once obstetricians tell it's good for moms, it's usually good for babies. The literature tells us that, we kind of pretty much have set the bar so high for our patient population that we're pretty comfortable with. I have not heard of anybody who having a really tremendous reaction. If you vaccinate millions of people, of course, something's going to happen at one point in time. But what we do is we administer the vaccine and we make them wait 15 to 20 minutes or even a half hour to stay with us just to make sure they're fine, and then let them go home, and then counsel them appropriate for any of these symptoms. If they persist after 48 hours, they ask you to, we would ask them to report back to us that they've had these symptoms so we can share this information with the CDC and the manufacturers of the vaccination. So we're really cautious of it. I'm really super proud of the team and what Karen has done with the vaccination pods and really ensuring patient safety, and patients, when they come in, they feel comfortable with getting the vaccine, because there's many questions about the timing of the vaccine and how long it took to come out. And I feel comfortable enough to get it. And I think that it's pretty safe.
Right. And we have not seen any severe, as Dr. Morrish alluded to, when patients get vaccinated, we observe them for 15 minutes, and we have not seen any reaction outside of the few things that he mentioned, sore arm, little fever, that's it.
Yeah. I think Karen and I are the poster children of the COVID vaccine. So we're in good shape.
So the people that have received it, is it varying levels of underlying issues, like underlying health conditions before they take the vaccine?
Yeah, so that's a great question. I mean, we have, when you're vaccinating 1,200 or 1,500 people are going to have heart disease, people are going to have hypertension, people are going to have diabetes, people are going to have all these different medical issues. And even in that amongst, which is a great cross section of individuals, different age groups, different ethnicities, everything else, everybody seems to be having the same experience. A little bit maybe discomfort in the arm, and that's it. I don't know of anybody who had a severe allergic reaction, but it's a great question. You know what it is? I think the Rockaways is a great melting pot of different individuals and ethnicities and ages and medical conditions. And it's a great community to understand that if we're vaccinating the community and the community is responding well with it, it's a great testament to the safety of the vaccine. And I have no vested interest in the vaccine other than making sure that our community is well protected against a very bad virus.
Right.
And I just have one more question. So I heard that you guys said the first one, the Pfizer, is for 16 and up, and then the Moderna is for 18 and up. Right. Do you all have any information as of right now about if it will be a requirement for children to get the vaccine? Because with school opening back up, different people, are on the fence about the vaccine. So if that's a requirement for the adult in the household to get the vaccine, that might sway how parents decide what they're going to do as far as schooling.
Karen, you want to talk to that, or you want me to talk?
No, we have not. The vaccine is not mandated. It's voluntary currently right now. We don't, as Dr. Moore said, information is changing daily. So that might change as school starts to open up in September. I would say as a parent, for myself, it's a mandate for me to make sure that I get the vaccine so that I can protect my children from contracting.
Karen makes some really good points. One, the vaccine is not mandated, which is the first thing. And I think that, most of the studies have not been conducting on individuals who are less than the age of 16. And I'm sure all the pharmaceutical companies are starting to do that and take a look at it. But as far as I know, and once again, I don't work for the Board of Education, and I'm by no means an expert in education and vaccination of the pediatric population, but there are no requirements. I think, and I always look at it, I have a 7-year-old and I have a 9-year-old at home, and they go to school and we talk about hand hygiene, social distancing, and making smart choices of staying away from crowds and other individuals and respecting everyone else's space. I think that, you know, as Karen said, I got vaccinated, Karen gets vaccinated. Whenever there's an opportunity to protect my family and the groups of individuals around me, I think it's being responsible in doing so. It has not get to the point where we're offering it to children or adolescents at this point in time. It's just all of us as we come together and do the hand hygiene, the proper PPE utilization, and we respect each other's space and make smart decisions for all of us, that we can really go really far. What the Board of Education is doing for the coming months, I'm not particularly sure, but that's going to be a really good discussion coming forward. And I think they'll make some good choices for our kids.
Right.
Someone in the chat asked about the feedback from the Johnson & Johnson vaccination.
The feedback as to when it's going to be out. We know that it's in process now. There's not enough information on it as yet because it has not received authorization. We know that on the first study, it had about 70% effectiveness, and there was still more testing going on. So as of today, we know that that vaccine is not yet approved.
Well,
So
one
the
of the things that
CDC
I
does
think
not-
we're I'm super proud of is that day one, Karen was able to secure COVID vaccine once it was we were one of the first hospitals in all of New York City to receive the vaccine. And this is not an announcement for Pfizer, but the efficacy of being 95% coverage against against COVID is really a fantastic number. And although it's 2 injections, I'd rather have 2 injections and give myself the 95% efficacy versus, you know, maybe 1 shot that's a little bit lower. But we're still waiting to see what the exact data comes out. So I feel that, you know, government is really stepping in to help us out as much as they possibly can. Would I love to see the floodgates open for the Rockaways and say that we can vaccinate all 140,000 members of the peninsula? Absolutely, yes. And St. John's is committed, you know, to helping out when we're called upon. But I think that we're headed down the right road. If you take a look at all the zip codes that are surrounding 11691 or the rest of the zip codes around us, you know, the Rockaways are doing really good. Social distancing, keeping the rates low. If you take a look at the zip codes outside to South Nassau, Jamaica, the numbers are exploding. We see that on a regular basis. So we got to applaud the community, the parents. It's not easy keeping your family safe and being a good citizen with each other.
And so far, we know that Pfizer was studied in ages 16 and older. So I think now they're starting to study it in pediatric patients. So once they have sufficient data, then they'll start to speak on what the requirements are for children to be vaccinated. And that could happen by school start, because I think they're looking to get everybody back into the classroom by September.
Yeah.
Hopefully.
Okay, thank you. Thanks for all that information. Another person asked about side effects if you are immune compromised.
So if you are immune compromised, and they haven't given us a specific definition of immune compromise can come in many different ways, but immune compromise would put you up in, I believe, 1B, if I'm not mistaken, right, Karen?
Yes, 1B.
For the individual. So if 1B comes available, an immunocompromised might be somebody that might be going through chemotherapy or might have an underlying medical condition that compromises your medical conditions and so forth. So then that would actually push you up higher on the list, because obviously an infection like COVID, you know, they're more susceptible. So we would like to see you get vaccinated quicker than anyone else that might not be in such a good medical shape.
Right. So the thing to note also about the vaccine has no contraindication, which means that you can take it irregardless of what's going on. The only thing is that what we require is that if you're immunocompromised, you need to speak to your physician. And your physician will tell you, as Dr. Morrish alluded to earlier, it's a risk benefit. So they are going to tell you to eventually take the COVID vaccine. We did have a few employees that had the same questions. We told them to reach out to their physicians. And what they came back and told me was that their physician told them that the vaccine is for them. So they should be vaccinated, and they did get vaccinated.
Yeah.
Wow. Okay. And then one last question. Someone asked if the Pfizer was, it, I guess, was created to protect against COVID versus
exactly.
you not getting as sick.
So it gives you, and Karen can always probably jump in on this. So it says 95% effective. So if you're exposed to COVID 100 times, 95% of the 95 times, you won't get it. The 5 times that you might get it, okay, and it's very slim, it might not be as severe.
Right. That's one of the advantages of being vaccinated, right? Because it lessens the severity of the disease.
Absolutely.
Same thing like getting the flu vaccine. You can get the flu if you have the vaccine, but the severity of the flu is not that great, so it won't kill you.
So one of the things that I would like to do and jump on the bandwagon is that although COVID vaccines are super important and they might not be available to everybody at this point in time, it is flu season still. And I would suggest that everybody who is available to get to their primary care doctor who has not received their flu shot, go get your flu shots, because you can get COVID and flu at the same time, and that would really put you in bad conditions and so forth. So flu season is super important. Flu kills people too, in addition to it. So I would like everybody to get out there and consider getting a flu shot too.
And that the children can get. The children can get their flu shot. So make sure that the kids are
super
vaccinated.
important. Super important.
Okay. That's all that I saw in the chats. Does anyone want to unmute themselves to ask any questions? If not, then we will thank the doctors for their time. And
yes,
I have a question. Hi,
Yes,
I have
go
a
ahead.
question.
Sure.
I heard I heard myself and somebody else. I'm not sure. Well, my question is, I heard that you both took the vaccine, but from different companies. Was there a reason for that? Was it because maybe Pfizer was available at the time you took the vaccine, or do people get to choose of the two companies which one they want to take?
So good question. So Karen and I are both in the Pfizer camp because that's the vaccine that we were provided to the hospital. We weren't given a choice. I think, and Karen can talk to this a little bit better than I can because she's a lot more knowledgeable of it. Once one vaccine gets sent to an institution, they try to keep it the same not to create confusion. So if everybody's getting the one shot at day 1 and then day 21, everybody in the group gets it as this. So there wasn't any selection for either the Moderna or the Pfizer. They sent us the Pfizer. We were grateful for it. So Karen and I both were vaccinated by Pfizer.
I think what you might have heard was that I mentioned that my daughter received the Moderna. She received it in another institution that she worked at. So I would join the comparison that I received the Pfizer, my daughter received the Moderna, and we had no side effects.
Thank you for that clarification.
Side effects, and I didn't have any side effects, even though we took different vaccines.
So anecdotally, I know a lot of physicians in other hospitals, and some people in the Pfizer camp, some people in the Moderna camp. I think we all pretty much had the same outcomes or symptoms associated with it. So not much of a difference. I don't think anybody could really tell.
Right. And there was no choice in the vaccine that you received.
Yeah.
They didn't have all Pfizer. So that's why they had to give some hospitals Moderna. Plus I mentioned that storage was a problem, right? If you did not have that ultra cold freezer, you were not going to receive Pfizer because Pfizer requires that special storage. So we had that ultra cold freezer. So we were able to get Pfizer. And it was not a request. We took what we got.
We're happy, right?
And we're happy, yes.
Okay. Hi, good evening. I have a question. I know I just came in late. A quick question. Do my kids have to take it from their doctor, or they take it from the school when the school comes back in section? Is it mandatory for them to take it before they come back in school, the vaccine? If they don't have no symptoms or they don't have no COVID, do they have to still take the vaccine before coming back to school? Is it mandatory? Is anything, because I know I came in late, I didn't get to hear.
Yeah, sure. So I can't speak on behalf of the Department of Education, but we don't know, I don't have any information about that. But any kind of vaccination is not mandated for the most part that I know of at this point in time. We're not mandated in the hospital. And none of the, nobody under the age of 16 is able to get the vaccine just as of yet. We're waiting for pharmaceutical companies to come out with new products, new vaccines at the time. So it's kind of a wait and see. We're talking to the population of 16 and over and parents, just to give them a little bit of an information as to what's going on in the neighborhood right now. And as more things develop, whether it be accessibility to more vaccines or new vaccines or any vaccines that might affect, children going to school and so forth, we'll be sharing that information as well as local and state government.
Okay. Thank you. Thank you so much.
So I have a question. Is there anyone now on the line now that received vaccine, any of the vaccines as yet?
All right, so Karen, you and I really have to get out there and start asking for more vaccine from the government to get everybody vaccinated, because it's really important. We're trying to be big advocates for our partners at the charter school and everyone around us at this point in time. Karen and I sit quite often together with multiple members of administration and clinicians in our hospital, trying to figure out ways in which not only can we, take care of people in the hospital, but how we can partner with our community, because, where we work is our community and we're really always looking for it. I know Dr. Muir has been a really big advocate of trying to get more vaccines into the area itself to make sure our community members. So it might not look like we've done much in the community, but there's a tremendous amount of work going on behind the scenes, knowing that, you're just as anxious of getting a COVID vaccine as we were, and we're going to continue it until we get everyone on the peninsula.
Everyone vaccinated, yep.
May I get some clarification? The information that we have is that before a child can come back into the school, the parent has to give the Department of Health permission to swab their nose, because we've been told that the Department of Health, once we open our doors, can randomly come in and randomly select 20 to 30% of their students. And I think this is what Mom was referring to when she wondered what did she have to do in order to come back to school. And I thought I remembered them saying that children cannot come back in if they refuse, if the parent does not choose for them to get swabbed.
Yeah.
Can you clarify that for us?
Yeah, I wish
because
I could.
This is my school community.
Yeah, I wish I can clarify that, but the rules change all the time with the schools itself, and I'm not particularly sure with that. I can look it up and see and call the health department for you and see what the process is, but we're not really privy to that on a daily basis, because it separates us. We have a set of rules that we need to follow, and the school does. And I know that there's the Board of Education, and then there's the Department of Health, and they make it a complete quagmire to figure out exactly what's being done. But I think that what we can do, if you forward me your information, is I could probably send you a few resources in some locations to get a clear answer for that. I wish I can give you an answer to that, but I don't have that information.
I think what I did hear is that New York City is looking to swab, to COVID test the children before they enter the classroom.
Yeah.
I don't know if that's finalized yet, but they're looking to COVID test them.
Yeah, I know at one point Tanya was asking for consent. Yeah. Yeah, I think what
Mhm.
happens is I heard at one point in time, and I can't speak to the specifics of it, that they were asking for parents for consent to swab their children in class at least once a month. I know
Right.
that was going on too. So there's
That,
multiple things and multiple testing going on at once. And I don't want to give you an answer because I'm not an expert like you are, teachers and administrators in school. I'm just a doctor and working in the hospital. So I can't really speak to that. So, but I know that you've got a lot more on your plate than I do. So, I can guide you and put you in touch with the right people.
Okay, because now that mom has asked that question, I'm thinking that's what we've been directed, but I would like to have that clarification so that we all know.
All right, I'll
Good
be.
deal?
Yeah, absolutely. I'll be in touch with you.
but I'm
Thank you.
sure the Department of Health will be, the Board of Health will be sending out that guidance as school gets closer to reopening for the fall, or
Yeah.
when they get ready to roll that out.
Thank you.
You're welcome.
Welcome.
Are there any other questions for the doctor?
Please ask.
But my question, none of you has received the COVID vaccine as yet?
So I haven't, but my mom and my brother have. My
Okay.
mom got Moderna and my brother got Pfizer.
And how'd they feel after it?
Yeah.
My mom just had a sore arm, like a regular. It was a little warm around, like a little warm around it, but that's with like any vaccine. My brother actually got his at 2:30 this afternoon. And he's, feeling fine. He's, still bouncing the volleyball around the house, so he's normal.
Yeah,
Good to hear.
my husband took it too, and my mom-in-law, they took their second vaccine today. Like what she said, they were sore in the first 2 days, but after that they feel fine now. But it's me, I didn't take it because I'm kind of scared to see the outcome of it. But since I'm seeing people taking it now, I'll go ahead and take mine.
Yeah, you know what it is? I always say to, everybody's always asking me, oh, should you take it? Should you not take it? And I always say, you know what it is, between all the medical literature that I read, and I'm sure Karen can say this too, the medical literature you read and all the patients we say, if we got vaccinated, and we're willing to give it to my wife or Karen's husband at any point in time, I think that it's pretty safe. And it really, speaks to, practice what you preach. And I feel total confidence that this vaccine was done well. It was studied well, and hopefully we will all benefit from it. So I have no reservations from it. But once again, that's kind of a little bit from where I come as a physician and treating patients over the last 20 plus years.
Right. And also, Dr. Morrish, we've been in the middle of the COVID storm.
Oh yeah.
So we know what COVID can do.
Yes.
Yeah.
It's residual effect after post-COVID that patients still suffer from. So we know. So
Yeah, it's a
having
great
vaccine now,
point.
it's definitely worth trying.
COVID in our lifetime, it was the biggest shock, especially in the area itself and the severity of it. We went through a very long period of time over at the hospital where if you walked in our halls for 1 or 2 days, you'd be very convinced in the fact that you'd wear your mask, you'd wash your hands, you'd social distance, make some really smart choices of where you go. And if the vaccine comes, you run for that line and get on it.
Yep.
Mhm. I'm just waiting for my appointment to come up.
Okay, good.
Yes, that's all I'm waiting for. I put myself in a position where when Dr. Fauci took it, and then I have 2 family members where their children are all doctors and one is an immunologist, and they have all taken it with no side effects. I'm there.
Yep.
Yeah. I mean, I had a
just
high
need
level.
them to call my.
Good. I had a high level of confidence, and then Karen got in front of me, and I felt even more confident.
So how long does the vaccine last? The rumor mill, it lasts a year. So is this an annual thing that has to happen, the vaccination?
We don't have that information just yet.
Mm-hmm.
So we're waiting to hear how long, if we have to take it annual, biannual, we're still waiting, but we know for now that the vaccine does give you some immunity. And so we've just tried to get ourselves immune from that COVID-19 disease.
Yeah, I think they've been stating in the literature that we know right now that it lasts at least 8 months, but they're still studying it and see what goes on from there.
Okay. Anyone else have any questions? Do you have any information about the antibody, like, after you have the COVID, you test and then you test for the antibody, you have the antibody. It's true that you have to take every 4 months to check if you have the antibody.
Once you get the vaccination, you do not need to do an antibody test, none whatsoever. You get your second dose, you're in good shape, about 95% of efficaciousness of the Pfizer vaccine, but you do not need to check antibody testing, none whatsoever.
But what about when you had the COVID?
What's that?
So she's asking, when you do get the COVID disease, do you get antibodies?
Yeah,
do?
you should be getting antibodies. If you were infected by COVID, you probably have antibodies. Some people like to be tested just to know where they are. If they have a higher level of antibody, they're thinking they're better protected. But if you look at the medical literature and the all the guidelines, it says even if you had COVID and you haven't had COVID within a period of time, that you should still get vaccinated because it helps your immune system to know the virus and give you better protection.
Right.
Oh, okay, because I have been tested for the antibody 2 times and they say it's high. So they say they're gonna test again on March. If I have it high, I don't have to take the vaccine.
Yeah, you know, if you take a look at what the
they?
what's that?
I was asking her, who is they? Is that a physician that said you don't have to take the vaccine? Because that's not what we're told, right, Dr. Morrish? If
Yeah.
you do have the disease.
Guidelines tell us that even if you have a high level of antibodies, you should still get the COVID vaccine. It's really important that you get that duration because we're thinking natural immunity. So if I got COVID and I built up my antibodies, and although they're high, they start to go down after a while. And if I get the vaccine, it keeps me and gives me a higher level of protection against COVID. So they're telling everybody unconditionally, if you had COVID and not active at this point in time with COVID, that you should receive the vaccine when it's available.
Right, because we've seen people that has gotten COVID has gotten it again.
Yep.
Even with so you can get COVID more than once.
Correct.
I'm sorry, I'd like to ask if it's the fact that you can lose what's the word, immunity to the COVID infection. So how effective is the vaccine? Because isn't that like an introduction of some small amount of the virus to boost your immunity?
Mm-hmm. Yeah, so with the I think with Moderna and both Pfizer, it's an mRNA virus. That's a small fragment of it. Does not mean that you will get COVID when you get injected for the vaccine itself. It helps your immune system recognize it and fight it quickly. So it gives you a nice big boost versus natural.
No, yes, I do understand that. But if someone has a high antibody rate right now, because either they were infected or they were exposed somehow and they have these antibodies already, how is the vaccine giving them any stronger an antibody boost if after a while the immunity dwindles? What difference
Yes.
does it make if you're getting your antibodies from the vaccine or a normal immunity because you've been exposed?
So what they're doing is with the vaccine, it's introducing that DNA that's not infectious back to the immune system. So the immune system builds up another big response against it and teaches your immune system to go after it and be more aggressive than the first round. So if you were at 50% before they were fighting it, now you're getting up to 95%. So your body's really understanding what the virus is, that it's an enemy to your immune system, and it attacks it a lot more aggressively. And that's why all the medical literature that's well studied states that even with the high level of antibodies, you should still get a vaccine because the natural immunity before a vaccine starts to wane.
And does the immunity after the vaccine not wane?
We don't know. Up to 8 months right now, we know that we still have a strong response. But since the vaccine is fairly new and they're continuing to study, we don't know if you need the vaccine annually. They're determining that right now.
Okay. Thank you.
You're welcome.
Anyone else? Last call. Anyone else with questions for the doctor? Okay, well, we're going to thank you guys for coming out and for joining us this evening. Thank you so much for answering all the questions to the best of your abilities. And when we get back in the building, hopefully you'll come to visit.
Yeah, we'd love to come down the block there and see everybody in person without their masks on, but not until they tell us it's okay.
Definitely not until they tell us.
All right, folks.
All right, thank you.
All
Have
right.
a good night.
Stay safe. Thanks for inviting
Thank you
us.
so much.
Bye-bye.
Thank you.
See you soon.
Yeah.
Thank you.
Thank you.
Okay, so we're going to continue on with our meeting, right, Ms. Young?
Yes. So we hope that the doctors joining us provide you guys some insight, and if you have any more questions or anything like that, you can put it in the chat. I'll try to write them down and send it to them. But for right now, it seems like they gave us all the information that they have, and like they said, things are changing. So hopefully it was helpful. That was our desire for having them give us information. For right now, they don't seem to have a lot of vaccines, and it seems like they're gonna be coming up with, I guess, more vaccines to distribute. So hopefully you all make the choice that best works for you and your family, and hopefully we'll be able to move forward with the kids being in school and things like that, with everybody at their optimum health. Moving forward, we wanted to provide an update. So we have a few activities that we're going to be doing over next week into February, and we wanted to let everyone know about that quickly. And then Miss Jones is going to also share some information with us. So I just wanted to go over that quickly. Ms. Johnson, would you like to share the events, or would you like
Okay, it's okay. So after today, next week, Wednesday at 6 o'clock, we're going to have another family Zoom workout session. We do have a guest host coming in, Mr. Payne. He does Muay Thai karate and kickboxing. Yeah. And he has a plethora of different other programs that he's willing to offer. He's coming to us to offer us our family session for free, but he does have other services. So we're going to post his information so you can get that. And we're hoping for everyone to come and join us virtually on Zoom at 6 p.m. next week, Wednesday, which is the 27th. And we also have a family movie night that Friday. I want to say that's the 29th, just going off the top of my head, I believe. Yes. And right. And so we're going to do family movie night. I know we have a few movies in the running, but I'm not sure what our choice was as of yet. But please join us on the 29th at 6 o'clock for our family movie night. And then looking ahead, save the date for Thursday, February 11th, we are hosting our Art and Apple Juice night, and Mr. Rennie is going to be our host that evening. And so you bring your art materials, whether it's crayons, markers, colored pencils, paint, whatever you have with your paper, canvas, whatever you have at home, and your cup of apple juice, and come and join us for a night of relaxing and art.
And if you want to be fancy, it can be sparkling apple cider.
It can. So we're looking forward for our families to join us for those events.
Yes, yes. So without further ado, Ms. Jones, if you would like to take the floor and you can share the information you have with us.
Okay. I have information for you. I really thought that I was going to come on tonight and tell you the day that we were opening school. But day before yesterday, when I spoke to Mr. Pierre, we are still not cleared to open the building. We had air quality tests taken, and they still have not completed all of the tests. I promised you safety, and we still don't know what is still or might still be in the building, and we want to make sure that we have taken care of that. I wanted to take a picture of how we were setting up, but I'm going to wait till next week, and we will probably call another meeting so that I can tell you next week what is the update. I'll be able to tell you. But in the meantime, I wanted to share with you the document that I was going to give you tonight, and you'll be able to see it on Dojo. It's important I put it on Dojo so that our Spanish-speaking parents can translate it through Dojo and know all of the same information. There was a survey that we asked parents to fill out some time ago, and some of you did and some of you didn't, but that is how we make plans. So some parents within that survey told us that you wanted your child back in school, and you completed the Department of Health permission form to swab your child's nostril. That will tell us, because children are typically non-presenters of having COVID. But if you did not complete the survey, and we found that at least half of our parents did not complete the survey, you cannot return until the next survey is given. And I want you to think about whether or not you want your child to participate in that random swabbing of their nostrils. I want you to think about it. You don't have to make that decision tonight, but it is necessary in order to protect our school's population. I am keeping all of the adults out of the building. Our teachers will still remain remotely teaching. So as adults are the as adults are the main carriers, we want to keep all of our teachers out of the building right now until further notice. But if you want your child to return, you have to have had completed it. I can't plan how we're going to handle the children if you didn't tell me. Let me show you an example. These are the children in this particular class whose parents completed the survey and want their kids back. And these are the children for that class that didn't fill it in or don't want their children back. And we have varying numbers throughout the school. Here's another grade. The kids, the icons on top are the children who are wanted in, or the parents completed it. And at the bottom are the parents who did not complete the survey or don't want their children. So you can tell, I hope that you can tell from viewing this that knowing who's coming back is the only way that we are able to plan for the children to return to the building. So when we send it out again, I'm only giving you 3 days to fill in the document. So please think about it now so that when the survey is given to you again, you quick send back completed. Okay, Ms. Jones,
I have a
here
question.
are the criteria. Yes, Ms. Deniellys, yes,
So
ma'am. What is your?
hi. So I have a question.
Hi.
Miss the other Jones asked if said that on January 19th, second grade pre-K have to go back into the school on January 9th. Is that still happening?
No. Pre-Ks and kindergartners as of today, and that might change, but pre-Ks as of today and kindergartners will not come back in until we open the school for everybody. So this early opening, and I can't give you the definitive date yet, will only occur for 1st through 5th graders. We're going to set the children up in a single room so that they can have ventilation, they can have space, we can do the social distancing and still be able to do school. Did that kind of answer your question?
Yes.
Good. Okay. Ms. Jones, can you bring up my reopening
Yes.
plan, please?
Excuse me. Yes, I have a quick question. What about
Sure.
what about if like the survey you said, if I don't fill it out, I don't want my kids to come back to the building right now. Do I still have to fill the survey out? Because now I understand. I remember when you sent that survey, I didn't fill it out. Now I just remember that. So if I don't fill it out, do my kids have to come back to school? Because I don't want them to come to the building right now.
They
But
cannot.
they cannot.
That's
Okay.
perfect.
Mhm.
That's
But
perfect.
But still,
Because
do
if
I have
I
to
don't
fill it out?
know if you eventually, I want you to fill it out so that we can verify. We have to report. I got an email today from the city. What are you all doing? You were supposed to have opened at the top of January. And so they want to know, when are we opening? How many kids are coming in? So filling in the survey only documents for us.
Okay.
But
Okay.
you're perfect right now. You're not ready for your children to come back in, so it's okay.
Okay. So
They will remain remote.
Okay. So if you send the survey, should I fill it out still?
Yes, please.
Okay,
Yes
ma'am.
or no.
Okay. Okay, ma'am. Got you.
Okay.
Thank you.
Ms. Jones.
Yes,
Me.
ma'am.
What
I
happened?
see you.
Hi, Ms. Jones. What happened? I'm not feeling good. What the lady said, I'm not feeling good. Could come to the school and I keep continuing learning by computer like this. I need to fill it out the paper also.
Yes, you need to tell me no.
Okay. No. Okay.
Excuse me. I
That's
have
all.
one
You
more
just have to
question.
tell me no.
Another question. What is the day you're supposed to be school open? Next month, March, April, what?
I can't tell you that yet. I cannot tell you. It will not be March. Well, I can't tell you. We have to wait until we get the certificate of occupancy from the Department of Buildings. I can't put the school at risk for being fined. I don't want to be on the headlines of the news saying that school opened without being okayed. You know, there was a lot going on in our building when they removed that roof. And we want to make sure that that air is clean. Our roof was over 100 years old. And so when they took that roof completely apart, we're talking about asbestos. I cannot bring our children back into that building and not know beyond a shadow of a doubt that the air quality is clear and clean. Because I'm going to be there too. And I'm not going to put myself in jeopardy along with your children. I'm not putting them in jeopardy. So I am willing to wait. I'm speaking on your behalf. I'm willing to wait until we know that the air quality in that building is clean. Plus, we're going to get, for wherever the space is, whichever space we decide to use, we're getting air purifiers for the room so that we will know at any given time what is the air quality in that room. We're just not leaving it to chance. I might decide at 1:30 in the afternoon, let me go check this and make sure the quality of the air is still clean. Then I can do it. I don't want to have to apologize later when there is something that I could do up front. So I'm being preemptive. I'm trying to get ahead of any possible problems. Okay?
I have a question.
Please ask.
So what if you you say yes for the survey and you need to go for a few, you need to stay out for a few days, but then you go back to this school again?
Wow. We have to cross that bridge when we come to it. Like I am afraid for when some days I would hope that you would not take days off without letting Miss Johnson know why were you taking some days off. Because our first assumption is that you're sick and you just don't want us to know. And that's not honest, and that does not help protect everybody. So if you plan to be out and your parents have you out, I ask that they contact Miss Johnson and let her know. Listen, we were not going to come back to school immediately after Christmas break because I know many of our school students have family and relatives, plus a lot of my staff have family and relatives in other countries. And there was the possibility that you might go there, that you might be going there during vacation. So I gave initially that 2 weeks to give people a chance to self-quarantine before we were coming back into the school. But as it turned out, we still can't go back because of the testing that has not been completed for our building.
Oh, because I just wanted to ask, because my mom was thinking of going in a vacation in February.
Well, you have a week off for vacation in February, but then there's also the chance of when you come back from that vacation that you may have gotten COVID. So that's a decision that your adult family members will have to make. I want to take a vacation too. But until I get that vaccine, I'm not going anywhere. But if you go, promise me you'll wear a mask, okay?
Of course I will.
I don't hear anything.
Of course I will.
Hmm?
I said, of
Thank
course
you.
I will.
I feel better already. I heard you then. Okay. Miss Johnson, you look out for that phone call.
I'm on the lookout.
All right, Miss Jones, would you put up the reopening plan? Okay, we're going to take every opportunity that we can to ensure that we have met all of the directives of New York State and the Department of Health. And the first phase of our opening will be with the students that we have already, where their parents have said, yes, they can return. There will be no teachers in the building, as they will remain remote from home. And then there will be a very limited number of teachers, limited number of staff monitors to support the students' learning while they're in the building. And instruction will still be given remotely by the regular classroom teacher. These are the things that we plan to do to make sure that we are preventive and that this is something that we're required to do. Health and safety checks every day. That means that when children come in, their temperature will be taken and they will sanitize their hands every day. They will only go to the bathrooms 2 at a time, but every single day, children will be reminded of how we function in that building. And this goes into effect once we open the school again, okay?
Ms. Jones, you have a question.
It will be a setup in the gymnasium. Already?
Yeah, yes. Hold on,
Okay.
we have a family with their hand raised. Genesis?
Okay.
Go ahead, honey, ask your question.
Hi, how you doing?
Hi, how are you?
Hi.
Good. Let me ask you something. I have family in Inwood, right? All the schools over there, they open, you know. So by when you think you guys are gonna open the school?
Well, you know, that's a different school district. That's considered Inwood. Nassau County.
The reason our school is not open is because we had construction done in the building. Our roof was replaced.
So that's the reason.
And we still have not gotten. That's the reason why we're still not open.
Because you're
I'm
under
trying
construction.
to. Oh, I was so disappointed.
That's the reason, because your school, the school where my daughter is under construction, not because the coronavirus, right?
Right. It's because of the construction.
Right. Okay.
And there were poisonous materials. Yeah. So most of the tests have been completed. There are 2 tests where I guess the whatever the surfaces are still in Petri dishes, and they have to give them 15 days to do whatever it is that they do. The gentleman told Mr. Pierre that he had written up all the rest of it except for these 2 areas. Once that's done, then I will have a meeting and let parents know that what day we can begin coming in. Trust me, I want to get back in.
Yeah, my daughter also.
I promise. It's not the COVID taking us out. It's not the COVID. It's the construction.
Right, and the construction.
There was asbestos in the roof.
Right. Oh, it was asbestos? Oh, I didn't know that. And
Yes.
when
So
they give you, like,
we want to make sure.
They already told you. They already told you the date.
They haven't given us a date.
Oh, okay.
We hope it's coming up soon.
I hope so
Yeah.
too. You know.
Yeah. Ugh, I'm ready. I'm sitting at home getting fat. I need to get back in.
Let me ask you something. Because my daughter, you know, sometimes I see her like a little depressed because you know, all day, you know, in the computer.
Yes.
If I want to transfer my daughter to different school, what are the steps I have to follow?
All you have to do is go to that school and say that you wish to transfer your child in. They will notify us.
Right.
And she's there. But I ask you for a little more time, please, because you also want the quality of instruction that she's getting.
I understand that. I understand that.
Yes.
Thank you.
You don't know what you're going to get wherever you go.
No, I know, I like the school. I like the PPA school, Thank you so much.
I would think I shouldn't be more than 2 more weeks.
Oh, if it's not more than 2 weeks, fine.
Shouldn't be.
Thank you for the information.
Okay.
Good night.
All right, continue.
Yeah, Miss Jones. Miss Jones?
Okay.
Yes,
Yes,
ma'am.
ma'am.
Yes, quick question, please, make me understand. You said if they come back to the building, the teachers is not going to be there, or do I misunderstood you? Can you clarify that for me, please?
The school and the roof was asbestos, so that's not healthy for nobody.
Okay, ask your question again, please.
Yes, ma'am. Make me understand. You said if they come back, if the kids come back to the building, the teachers is not going to be there with them. That's what you're saying, or do I misunderstood you?
That's a yes or yes and no.
Why is the teacher not going to be there if the school is open?
Okay. Because I have this many kids whose parents don't want them in. Only 1/3 of our parents said they wanted their children in the building. So what happens when we bring all of the teachers in and you only have 1/3 of the students?
I think that they're misunderstanding. I think they misunderstand it. It's not that the teachers won't be there. Your child specific teacher may not be with your child in the classroom. It may be another PPA teacher for that grade level. Yeah.
No, that's not correct.
No? Okay, wait, no, she's saying that's not it.
No. All right. What I intended, our teachers have made it clear they have a lot of fear about coming back in, regardless. And I understand that. The majority of our families have said that they don't want their children in the building. And I respect that. But I do know that there are some parents that do want their children back in the building. So when I get a date, I will let Miss Johnson know the date so that she can set up the buses. We will let the food people know so they can set up the food. And the children whose parents want them back in the building, like Miss Genesis's father, she can come back into the building. But the teachers, because the majority of the children are remote, the children will all still be on computer. I will be there in the building to monitor all the children who are in the building. Kids who need help, kids who, I'll be there for that.
Okay.
I'm gonna be super teacher.
Okay. Thank you, ma'am. Thank you.
I can do the best I can do to take care of both sets of parents, the parents who want out and the parents that want in. And I do have 2 teachers who have said to me, Mrs. Jones, we're gonna come in and help you. So you're not doing that by yourself, but I am prepared to do it myself, to have those kids come back in whose parents want them in.
Thank you. Thank you, ma'am. Thank you.
Are you with me now?
Yes, ma'am.
Okay,
Got
good.
you. Thank
All
you.
right.
Thank you.
That's why I have all of this information that I want you to read so that everybody knows what it is that we're going to do and how we're going to do it. We're putting it on Dojo so that the parents who need to read it in Spanish can hit translate and it will be there in Spanish. So I have the information about how we're going to remain healthy, and be there safely, talking about how we're keeping our facility clean throughout the day. But because the children are going to be in the gymnasium, I'm going to ask Mr. Pierre to be sure we have 2 days of heat on before we come back in the building, because the building has not had heat on since March. But I ask that parents put a sweater on their kid if their children are coming into the building. For food, we are still doing breakfast and lunch. However, the food will be brought to the kids so that we're not all in that lunchroom together. And then we'll have things for them to do during the lunch period so they're just not glued to the computer. I have games for them to play. They will be supervised. If the weather is better than 30, we can go outside so they can get fresh air. We're going to have organized play so that kids aren't just running wild and in each other's face. Every kid will have a shield that goes around their whole face, along with their mask, and we have a shield that goes around their desk. So while they are in learning mode, we're doing, as long as they're in the building, we're going to keep them safe. Ms. Johnson is going to set up the transportation. I know the bus company is sick of us. How many times have we changed transportation, Ms. Johnson?
A few times, but it's okay. It's okay.
But she soldiers on and takes the heat, but I'll give her the notice so she can get that date together. Next, keep going. Oh, I have a couple of typos. I'll fix it. The school schedule will remain the same. We're still only going to go from 8 to 2. It won't be until we open the school with everybody back in the building that we go back to our 8 to 4 schedule. But as our remote children are 8 to 2, the children who come in the building will also be 8 to 2. The attendance and the chronic absenteeism, the city and the state write to us weekly about our attendance, not our attendance, but attendance. And this is why we call, Ms. Johnson calls you, teachers call you, teachers dojo you. It's important that your children come to school. If you're not coming, please let us know. So it's not, because kids will fall behind quickly. The technology and the connectivity, we've done everything we can until now. Our new borough president, Donovan Richards, gave us a nice chunk of money. So we have purchased new technology, and as soon as we are back, we will get this technology and provide it for our children. Teaching and learning, we're still staying as high quality as we can. Our coaches are working with our teachers to ensure that learning and teaching are as good as it can be. But the biggest issue that we have are children not staying on the site. They turn off their screen, they log off and don't come back, and they don't understand the consequences of doing that. So we really need parents to speak to their children. We're in a new normal right now. We don't know we will never have life like it used to be. We may have to wear masks the rest of our lives. We don't know. We don't know what the future will bring. You must speak to your children about taking care of their education. They are the only ones who can do it. You can ask them, you can beg them and all of that, but help instill in them the importance of being mindful about their learning. Keep going, Ms. Jones. Special education, I still have a special education teacher assigned to every grade level to ensure that Our children are getting what they need. If you have any questions or concerns, please call Mr. Fairley, email him. You can copy me on that email to ensure that you feel comfortable with what's going on. And the same for our L students. Ms. Cuervo is doing an exceptional job with the number of children that we have, but she will soon have a partner working with her, because we have already recruited and hired a second L teacher so that we can have one teacher with our younger children and one with the older children. So as soon as we are able to legally reopen the school, we will. Not one day longer, I promise. But I thought I would let you know what it is you should know before we open the doors. Any other questions before we move to my second announcement? Any other questions? Why do you make special teachers do it for a week? I'm not sure what that means.
Probably the specials classes like music, they have it for 1 week at a time.
Oh, that was how they wanted to set them up. And that they shift around to be sure. They felt like seeing kids once a week, every other week, didn't give them adequate music. So that's why they chose to do it that way. I gave them that freedom. Okay? All right, number 2, major fundraiser. I think everybody knows that I belong to a sorority, and they pushed us into a fundraiser, and I wasn't gonna do it. But someone sent me a text message and asked me, did I need help setting up my mini store? So then I did it. So this is called Double Good. And what Double Good does, well, Miss Jones, put up the video that tells us what is Double Good. They were featured on the Today Show. And then I'll come back.
Popcorn every day. But it's not just the great taste that's earning them a lot of fans.
This is where the magic starts. We make amazing popcorn, and we make it to order. Double Good is about creating joy for people. It's also about helping people, and specifically helping people raise money.
When Tim Heitman started his gourmet popcorn business in 1998, he sold to national retailers and also to organizations that raise money for youth activities. In 2016, Tim realized the demands of big business didn't line up with his desire to help others. So he made a shift, focusing on supporting people's passions with popcorn.
We work with lots of youth sports organizations and youth activities, helping them raise money to do what they love to do.
When youth groups like the Benson Bruins in Seattle sell Double Good popcorn to fundraise, they get to keep half the profits of the sales.
We tried it and we were blown away. We went into this thinking, you know what? I think we can make $5,000. So we tried it and we ended up making over $24,000. So it's been amazing.
And when other customers go on the website to purchase or gift popcorn, 50 cents of every dollar support the Double Good Kids Foundation that Tim launched in 2017 to help children with special needs. The Double Good Foundation has helped a nonprofit organization called Surfers Healing, a group of professional surfers who teach kids with autism to surf.
to take a child that has never been in the water and go out and ride waves. And there was just absolute therapeutic effect on the children.
The most special part is really watching the parents watch their kids, and some of them not wanting to go out, but then coming back, they're smiling and laughing, standing up on a surfboard. And it's pretty amazing. Anytime you interact with our product, you're going to get something good, but you're also going to do something good. And that's that double good.
Tim says he measures success by how much Double Good gives back.
Everyone here really has very similar and very aligned values. And to come into work with people who share those values as you is just, it's amazing.
Everyone's striving in their life and their professional life to reach a certain level of fulfillment. And that's really how I feel at the end of every day is fulfilled by the mission of the company and the impact that we're making.
Tim says so far his company has helped people raise almost $80 million.
Wow, fantastic. And we got some right here. Usually when something, goes to charity, they'll say 10% of the proceeds or 15%. This is 50%. It's amazing. Kudos to him.
We'll be right back.
And so in the course of 4 days, my organization with about 72 participants raised $103,608. And our chapter will receive $51,804. And this was just over the course of 4 days. What happens is you set up your mini store. You don't have to worry about storing it. You don't have to worry about collecting any money. You don't have to worry about taking the products to your customers. They order from your online store. The company collects it, mails it, and sends you a check. It's just that simple. So, Ms. Jones, would you play the one about how to set up?
Double Good Pop-Up Store fundraising is virtual fundraising that makes it easy for your team to raise a lot of money fast without any of the headaches that come along with traditional product-based fundraising. In this video, we'll walk through setting up a fundraiser for your team using the Double Good app, available for free from the App Store or Google Play Store. Once you've downloaded and are signed into the Double Good app, the first thing you'll want to do is schedule your fundraising event for your team. From the home screen, tap on Create an Event and pick the fundraiser start date and time, and select your team's activity. Once your event is scheduled, you want to share the event code and details with the members of your team. Anyone that plans on participating should join the fundraising event prior to the start date using the event code you've shared with them. When a member of your team joins the fundraising event, they will create and personalize their very own virtual pop-up store, where they'll be able to sell 14 flavors of ultra premium Double Good popcorn. Once the fundraising event begins, participants will have 4 days to share their pop-up store link with friends and family via text, email, and social media. Purchases can be made from each pop-up store using a credit card and are shipped directly to the buyer anywhere in the USA. Once the fundraising event ends, you'll receive 50% profit from each pop-up store via check or direct deposit. If your team wants to do another round of fundraising, just create a new event from the home screen. That's all there is to it. Feel free to reach out to help@doublegood.com if you have any questions, and good luck with your virtual fundraiser. Let's see how much you can raise in 4 days.
And as you heard her say, you get 4 days to do it. And so it doesn't last forever. You set your own goal. I had a low goal. My low goal, I just set up for $500. And, but there were people who had thousands of dollars, but they have that kind of database. So, but you can set up however much money you think you can raise. Send it to your Facebook friends, those who are in your email, and just see what happens. You'll be surprised. You put an emoji in there, and you just take it from there. It's a lot of fun. You can chat amongst one another. They'll be mailing our popcorn out to us next week. And it's easy, fun. All you have to do is agree. Just think if we could have 100 of our parents set their store up and get that money out. It's so easy to make a lot of money quickly. So without the muss and the fuss, all you have to do is set up your store and it's done. It's done for you. They do the work. And you can raise a lot of money for the PTO that we are not able to do now. It's so much easier than the candy and the cheesecake and the wrapping paper and, all of those other things that we've tried. And, Miss Johnson gets stuck at the end, or the PTO president gets stuck at the end trying to figure out what to do with whatever is left. Miss Johnson, you could tell us some horror stories, can't you?
Okay.
So, I remember it. So this is one where it's no muss, no fuss, and you can make a lot of money. So for whatever of the activities you'd like to do. That's it, Miss Young.
Thank you so much, Miss Jones. I, for one, think that is a great way to raise money, especially with the social distancing and everything else. Like, we wouldn't have to worry about making sure the product gets to the people, because that was what kind of messed up at the end of last year. The fundraiser we started, it was going really well, and then the pandemic hit. So I would be interested in doing something like that, and we can take the funds and use it for something that's gonna brighten our spirits
when we come back.
Yeah, because
we can use it for anything fun when we get back to the building. It's good to have something in the bank. So it seems
you can do it before you go back into the building.
No, not do the fundraiser. Use the money.
Oh.
Right.
Oh,
yes.
Yeah.
Use the money.
Yes.
Oh, yes. Miss Johnson loves having these end of the year events where we bring in every kind of bouncy house and slide and popcorn machine. And
yes,
you can afford to do it now. You don't have to worry about me going, rah, 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 rah. Costs too much.
But if we have the money from the popcorn sales, we'll be okay. I could get my ride.
That's right. Mrs. Hofstadter, you had experience with Double Good?
Yeah, she chimed in and actually said her daughter likes the cheddar.
Yes, that was her first time ever having popcorn, and it was her absolute favorite. It's delicious.
That's what I heard.
Hi.
Hi. Hello. That's my friend. Yes, I understand it's going to be some of the best popcorn you've ever tasted. Maurice!
He's been trying to say hi for the longest. I've been like muting myself.
Hey, MJ.
Hi.
Say hi. Oh, is Miss Rush still here?
I am still here.
Yes, she's there.
His ears perked up when you started talking earlier, and he was trying to stuff his face in the screen.
Hi.
Hey, buddy.
All your children are popping up, Miss Resch.
Hey.
All your children. Thanks,
Hey,
Mrs.
guys.
Hobson.
Hey, Sophia. Hey, everyone.
Hello.
Hey, Kurt.
Hey.
Turning it back to you, Miss Young.
I am sad that I'm gonna leave this year because
You're on mute.
Oh.
Oh, I am sad that I'm gonna leave this year because I'm actually, this is terrible news to everybody, but I am not gonna be here next year, but I will come back.
Who said that?
Kurt.
He's
Kurt.
the 5th grader. He's
Yeah, you're going to
graduating.
6th grade. He's graduating. Kurt, stop it. You're graduating, man.
Okay, so if we have no other business, Ms. Jones is finished. We would like to thank everyone. Ms. Young, is that it? I believe that was it for the night. I'm just unsure, but I believe that was all. Does anyone have any questions? It was the fundraiser information as soon as we meet the executive PTO board and myself, we will send out all, and Ms. Jones, we will send out all information on Class Dojo. So please be prepared as soon as we get it out and running. We'll get the information out as soon as we can so we can set up the dates that'll be feasible for everyone.
And when
Yes.
we are opening, I will be right there to let you know. Okay.
Okay, everyone. Thank you so much for coming out. Thank you for your continued support. Please, everyone, continue to come to school on time at 7:45 in your PPA uniforms. And we will see all the scholars and their families bright and early tomorrow morning. Have a good night, everyone.
Good night. And
Good
someone
night.
put it in the comments.
night.
Thank you so much to the teachers for all that you do.
Yes, I
We
just
really,
saw that.
really appreciate
Oh,
you.
heck yeah.
Yes, thank you to our PPA staff, our teachers. You're awesome.
I miss McCord.
I miss McCord.
That was Kenneth.
I miss Allison.